Hello, everyone. It's been a little while. I'm sorry for the break, but I'm very happy to be back today with Dr. Esha Khurana. Esha is a psychiatrist and public health researcher in the integrated care setting here in Philadelphia, where she works to meet the mental health needs of medically very complex patients. She has clinical interest and expertise in post-traumatic stress disorders, palliative care, women's mental health, as well as global and community psychiatry. Her research encompasses ethical and practical questions of how to best allocate funding to reduce the burden of mental and physical suffering in the global setting, including aspects of implementation science, cost effectiveness, behavioral economics, and effective altruism. Esha, you are also a very dear friend, and my friendship with you and your husband has just been a great blessing for me and my family. You have a fierce intellect and an unendingly generous spirit. I started this podcast because I wanted to highlight people living with great conviction and humility. And what I find most remarkable and just truly admirable about you is your relentless pursuit of understanding over judgment. You are truly one of the most compassionate people I have ever met. And you live your life with just great love and appreciation and grace for those around you. You have an expansive array of interests. We have so much to talk about today. I think both of us share a deep love of humanity and a preoccupation maybe with human suffering. And so 2 hours will be one of our shorter conversations. Just thank you so much for chatting today, Esha. I'm looking so forward to it.
Oh, thank you for having me. It all felt so very warm to receive, and I could wax on about how grateful I am for our friendship as well, and what a gift it is to have you in our lives.
Yeah. So tell me, Esha, you are someone who I know about what young Esha was like. You are someone who could have done just about anything that she set her mind to. What drew you to medicine, my dear, and what drew you to psychiatry in particular?
That's a big question. I
This
think
is reaching far back.
Yeah, this is reaching far back. I think the draw to medicine definitely had components of like it was the acceptable career for Indian American families. So that was definitely handed to me. It was like doctor, lawyer, engineer, that whole thing. So it was on my radar probably younger than many kids because my parents talked about the physicians in their lives. I think my father is always a little preoccupied with his own health. My whole family is maybe a little bit. And so it was on the radar. I had eye surgery when I was 8 years old, which I think really catapulted it to importance for me. I had strabismus, and I had a really lovely eye surgeon who actually used to work at Will's Eye. He passed away a couple of years ago. And he was just a joy. I remember as an 8-year-old getting the surgery, and he personally wheeled me around the hospital afterwards and prescribed ice cream and TV. And I was like, this is a job, you get to prescribe ice cream. I kind of fell in love with my eye surgeon. And then it was like something I think I said, I knew it made adults happy. I'm sure there was like a realizing how that answer was reverberating with people around me, but also this sense of having really had a connection with the person who did the surgery. So it wasn't a really serious thought until actually I was 16. And then my grandmother had a cardiac arrest. She ended up going into a coma for several weeks, and my whole family got together. We were at the bedside as we were navigating the questions of palliative care and how to handle that as a family. And that also, of course, left a very, very powerful impression on me. So shortly after that, I happened to have a friend of mine, and I was in high school, who was training to be an EMT. And I had known that the EMT had been late to respond to my grandmother's cardiac arrest. So there was an interest and curiosity about what it was like to have been on that side of things. And the training program happened to be down the street, like walking distance from my high school. So I enrolled while I was in high school. And so at the age of 16, which is legal in Pennsylvania, I started volunteering as an EMT. And I think that's what really made more concrete how much I actually really enjoyed taking care of people. And what a gift it was. At that age, I don't think I'd been fully exposed to the stories of human suffering. I got bits and tastes, but it was a high school student. All of a sudden, I think I was catapulted into a world of seeing humans in their worst moments, really, right? Like emergency situations, whether it was death and dying. I certainly saw people who were in similar positions as my grandmother in a cardiac arrest, or all kinds of mental health crises. It was actually the beginnings of some of my interests as a psychiatrist, was recognizing that there were a lot of mental health crises intersecting with emergency medicine there, overdoses, things of that sort. And because of that exposure, I decided to apply into a program at Northwestern, which was a kind of combined medical program. Really a gift to do that as well, because I didn't have to focus on admissions into medical school. I was granted admission at undergrad. And I spent the next couple of years at Northwestern, I think, really solidifying who I wanted to be as a healer in a way that I think is actually really special, because so many people in that pre-med time are focusing on just getting into med school. And I got to do global health projects that really mattered to me. I got to really think about the questions of who I wanted to be, which I think really set me up well for medical school when I went there.
Yeah. And what was medical school like for you? Do you remember? Some people remember it favorably, other people not so much. You have an interesting mix of both, I think. So
yeah, I do. I went to Penn for medical school. I still work at Penn, so some of what I might say here will be like maybe with that awareness in mind. But I would say overall it was an incredible experience. I was young for my med school class, which I think really shaped my experience. A lot of I went to a guaranteed med program and went into medical school at 21, so very young now looking back. But also really surrounded by some amazing people, right? Like the people who I went to medical school with were brilliant. The Penn Med School class is just this like incredible group of people.
Yeah.
So I made friends who I'm still really close with, people who really shaped who I am as a healer, mentors, friendships that I'm very lucky now to be back here and to reconnect with a lot of those. There's some amazing people here. And so in that sense, I think medical school was very, very favorable, or like I had a really positive experience overall. In other ways, I think the going into medical school young, and I think with a little bit of idealism for sure. The formative years of medical training, I think, are the clinical years. Like there is everything preclinical, which is wonderful and about cementing those friendships for me. But I think those clinical years were very, very formative. And I think this would be the case in any medical training program. I think you start to get a flavor for what's the kind of healer you want to be. Who are the physicians who stand out to you as far as people who are approaching patients with compassion and groundedness and presence. And I think I saw a mix, right? Like in any other place. And my medical training was interrupted a bit too, notably by my own struggles with mental health. That's its own story, but I ended up taking a break from medical school to do a master's in public health, which was an incredible experience as well, and a different approach to being a physician, really thinking about these bigger questions of healing at the level of policy and society and systems, which I really enjoyed. Also made incredible friendships there. So overall, all I feel is just like it's such a gift to be able to have that time and space to do that much training and education and my case thinking and processing.
Yeah. Who are some of those people who you looked at and you thought that's the kind of healer I want to be? Or what type of physician left an impression on you early on?
I actually think I feel very lucky to have found like it almost felt like every specialty I went into, I could find that person, which is also pretty remarkable.
That's incredible. Yeah.
right? I remember, surgery, this is the difference between you and me. I definitely went into surgery with some apprehension, being like, I don't know if I can handle
I did too. Yeah. Yeah.
that. And I remember meeting, so many people on surgery who were I was just in awe of, like, your ability to cultivate presence there with patients while also holding together the needing to operate on bodies. I think is actually uncommon. Something I think I feel in you as a healer. So in that sense, you're one of my greatest teachers.
Oh, thanks, buddy.
Yeah, I think the rotations that really stood out, there were so many people, but certainly the folks in palliative care. I rotated through palliative care, I don't know, 4 or 5 times through the course of my medical training, whether it was in the family medicine side of my training in psychiatry, here in medical school. It's clearly a place I just kept going back to. And the thing that's unique about palliative care is it's so interdisciplinary. So I would have these incredible conversations with the physicians, but also nurses, social workers, chaplains, such like rich, multi-pronged perspectives on healing from so many different people. And I think that was really unique and special about palliative care for me. But I felt like I found some of those folks in almost every rotation I went into, which partially informed my I had a really hard time deciding what I was going to do as a physician, actually, because of this, I think.
Yeah. Yeah. I think that's one of the things I admire the most about you is you bring that enthusiasm and that doggedness to understand to just about anything that you're doing. So I can imagine you were an eager and enthusiastic, surgery clerkship student as you were on your psych rotation. I think your love of learning is just, it's one of my favorite things about you.
Thank you.
Do you remember when you decided on psychiatry? What solidified it? Was it your exposure to palliative care early?
I think the palliative care exposure helped shape it, but I actually think it took me a while to realize that that's what I wanted to do. And that's partially because there was stigma against it. I think even like subconscious, unconscious stigma that I had registered against it. And of course, my family had its own history with mental health as well that was not talked about. I didn't become aware of it until I was an adult. My grandmother had struggled with depression, and there were actually, especially around partition, there were several people who had struggled, understandably, with this mass migration and the trauma around it, but nobody talked
in India.
Yes, partition
Okay.
in between,
Just,
India and Pakistan, yeah. So my father's side of the family was a partition family and fled from what is now Pakistan to India. And yeah, horrific stories and trauma that came out of that, but not talked about at all. So I wonder, like, at some level, there was definitely a little push away. And I actually thought for many years I was going to be a neurologist. I knew I had an interest in the brain and the mind very early on. That I had registered, but I think maybe because of that, pull away from the mental health side of things. I was really leaning more towards neuro until really the years where I took off for my own mental health. I think that's actually what brought me back really to looking more closely at psychiatry. I think it was a combination of having done the master's in public health and realizing, for this interest in the mind and the brain and of course the body too. I don't like to separate the two. I think artificial divides that go back to Descartes. But that interest in the whole picture is such a part of public health as well. I think I realized psychiatry was just going to fit better with some of those questions in public health. And I also think after having struggled on my own, I realized like there's such a depth and richness in that space I had always felt like the mind and the brain felt like outer space, like this uncharted domain that we still don't know so much about, but are learning so much about. And I think this is taking a very long journey and kind of shortening it, but I think the work I did on myself in those years allow me to come back and look more closely at what I was really interested in, what really mattered to me. And it just became so clear that psychiatry was a place to do that.
Sure. And so tell me, Isha, how did you approach your own struggles during those years? What was your life raft during that time in your life? You know, you were younger than a lot of people, which I think can be very challenging.
Yeah.
Medicine is a very high stress environment, and the more robust your coping mechanisms are before you start. I mean, it's hard no matter where you are, but in your
Yeah.
life. But I can imagine being even younger, it can only be more challenging.
Mhm.
So what were some of the tools, and and how did you arrive at the self-awareness that maybe you needed to take a pause and collect yourself before proceeding?
Yeah, it took a lot for me to take that pause. I think I had incredible friendships. When I was in medical school, I was also part of this amazing community. I was living and working as a graduate assistant, which
Yeah.
is a system that exists here at Penn where graduate students can live with undergraduate students in the house and you get free housing and board, which was amazing. But and as part of that, I was part of this a house of other scholars and undergrads and graduate students. So I had these really rich friendships with people who were just right down the hallway, and they connected me to other people. And so it was this. It really was the like prototypical support network
Yeah.
that so many people lack. I think like when I think about some of the folks I see now, that's so uncommon.
Yeah.
So I had that. I also had some of those mentors who I mentioned earlier, for sure. Physicians who, when I started struggling, I reached out to, and there were a few in particular, Michael and Karen, his wife, and a few others who I still really love, who, and other folks in the medical school who pointed me towards the resources I really needed, which in my case was therapy, some trauma focused therapy for me, and then I had friends who had been in counselors, like Pete,
Sure.
who's has this like incredible background,
Oh,
as have been a spiritual counselor, and my own mental health struggles at that point were really catapulted by this uncommon scenario of like really intense meditation.
yeah.
So it was also like I think I needed almost like a niche team. You needed
Yeah.
somebody who know how to meet somebody who had this was in the world of meditation what we might call like a dark night of the soul experience. It's not uncommon for people to talk about after who've do really long prolonged periods of meditation, but for people who don't do prolonged periods of meditation, that's not a common there's not a common understanding of what those experiences can be like. So I really did need to have, I was really fortunate to have a group of people who I could go to with some of those experiences, and he knew exactly how to meet it. And then I did a lot of my own work. There was a lot of reading for, I'm going to call it spiritual seeking for lack of better words, but a lot of ongoing work with meditation therapy. It definitely set me off on like a love of exploring the world of therapy meets meditation.
Sure. In fact, that's a nice segue. You've had a active and robust meditation practice your entire life, dating back to, I don't know where you would say as a child.
Yeah.
But tell me a little bit about that. That's quite unusual.
Yeah. Yeah. I mean, it seems unusual, but I think when for Indian homes, and it's actually not that unusual. I grew up going to a North Indian temple where we did what is, common, what people often know as like kirtan or bhajan, or also known as bhakti yoga in India. So devotional prayer to different gods, which is very meditative. You're often doing chanting. It's really like chanting of mantras to songs with drums in the background. It's very hypnotizing,
Mm,
trance-like at
sure.
times. And so I definitely have early memories as a child of being in trance, really,
Wow.
which, what a gift. Like those
Sure.
early states of meditation that I didn't even realize were meditation, but
Yeah.
were totally that. And then I formally started meditation, which I started with what is also a very good concrete step of meditation for early meditators, which is called japa meditation in India, or mantra meditation with meditation beads, which of course that's a tradition that exists through multiple cultures, just like meditation in general. But so I started doing that when I was a teenager and found it to be very grounding, very centering. That was just what I had been taught. Again, very common to be taught those kinds of practices in an Indian home. And meditation, prayer, and ritual are part of day-to-day life in a Hindu home. So we were doing some version of it, a lot, actually, I think I realize now, which is pretty remarkable. And then I definitely didn't relate to being Hindu per se when I was a teenager. I think there was no formal belief taught in our home. I just knew my parents, my mother prayed, my father sometimes prayed, but there were stories told, but I definitely had an early, I think I went through what many teenagers would go through, which is something like, I don't know that I believe in the gods here.
Sure.
And so when I went into college, I definitely called myself more agnostic and took up more of an interest in a less religious meditation practice, and interfaith, really, like a curiosity about faith in general. So fortunately at Northwestern, where I went to school, there was an amazing interfaith community, part of that being very much assisted by the fact that the Baha'i temple, which is it was the only Baha'i temple in North America at the time, was down the street. And so there was just really, and it actually has one of the highest concentration of churches per square block in anywhere in the States, which I don't think people realize. So there's a lot going on in that area in Evanston. And I started, I think this is part of my being out of high school, having struggled with the relationship with my parents for sure. And needing a little bit of respite. And I started meditating more separate from any religious belief, in more of what would be called anapana, more breath-based focus, through undergrad. And it was an amazing practice to have cultivated that time. I got to meditate in some beautiful places, like along the lake, and in churches, and at the Baha'i temples, just magical. And I think that's what really cemented an early on relationship with a regular meditation practice. And then of course, medical school really changed my practice too, because everything I just described, all of a sudden, this isn't a practice just about calm. It's about, which I think it was before. I think it was about calming myself and grounding myself and centering myself. But all of a sudden it became much more about how do I meet suffering? How do I hold presence and spaciousness for what the world will bring? And that really challenged me in a really worthwhile way. So my practice really changed and transformed, and that period of having done my own internal work and therapy suddenly made me realize there was a lot more than just meditation and just focusing on the breath. But I think that's how mindfulness is often billed, is you focus on the breath and it'll help you get calm. It is all that, it can do all those things, but it also, I think that whole process launched me into a real in-depth study of meditation practice as a way of being in the world, in a way of meeting the world, the work I was going to do as a healer.
It's interesting. So if you had to say today what your meditation practice looks like, what balance is it between sort of a worshipful exercise versus a training your mind exercise and centering yourself, or is there no distinction between as someone who doesn't meditate, what is help me understand that.
Yeah, it's a really good question. I guess one of the things I didn't mention was, in the last couple of years, and you and I have talked about this, I interestingly, through a lot of different means, I still really love traditional mindfulness-based practices and practices that are like, especially coming from the Buddhist tradition. But I also came back to really Hindu-based practices. And there were a lot of different reasons that happened. One was that I happened to, in my medical school training, I started going to an Advaita ashram, which is out. It's called Vidya, and it's out in like just north of Allentown, not too far away from Philadelphia. And Advaita is a certain kind of return to its non-dual based Hindu belief and practice, and that shaped me coming back. Having friends who were Hindu, like some of the people I mentioned, who had meditation experience, definitely shaped me coming back. Just reinterpreting and re-understanding Hindu practice and what some of these teachers in Hinduism were trying to do back then, like in a much more nuanced way than what I think I had been taught as a young person. It was much more than just these stories.
Sure.
And then I think in the last couple of years, I started really doing what I think is a really unique practice. I would think of it as like meditation meets, I think of it as a kind of meditation, which is what some people will call imaginal practices, or I think it's the most consistent with Rob Burbia's Soul Making Dharma, for folks who are familiar with that. That's a meditation teacher who thought about these kinds of practices. Or another strand that this is consistent with is what some people would call tantric-based practices. Is my understanding. I may have, going with a lot of humility around, I don't know the right names for these things, but this is the closest to what I can imagine, which is practices where you meet deities meet them in your practice, in meditation, and work with them and allow them to guide you. And I started incorporating that into my practice in the last 2 to 3 years, and it kind of unfolded naturally. I didn't try to, which is even more interesting for me anyway. Like the fact that at the right time and space, I think for where I was, it started making sense for me to start asking for a guide in some of the work I was doing, and guides showed up. And now they've taken on the forms of some of the gods I grew up with, which is really interesting. But I think they can take on many different forms, and they're beautiful to work with. They've been a really centering focus in my practice. And so interestingly, I do that, and I would call that meditation, but also like a deity practice.
Yeah.
with other kind of more traditional Buddhist-based meditation practices.
So Isha, now I'm so curious. Was there a time where it sounds like you solicited counsel from guides before they were explicitly deities?
Mm-hmm.
So do you remember having, like, who came to guide you that wasn't a god during those years?
Yeah. So my first guide was my grandmother. Actually, the grandmother who had passed away from a cardiac arrest. I was trying to navigate some things in my residency, and didn't know what to do, and was meditating, and these questions kept coming up. And so it was clear that there were parts of myself that were chewing on these questions and didn't know where to go and were feeling lost. And so at some point, I think like this, I was kind of working with a mode of therapy called internal family systems. And as part of that, you work with parts of yourself. And my grandmother started kind of like emerging as a part that wanted to guide me. And over time, she transformed into Durga, or one of the Hindu gods, who is like what we would call Shakti, like feminine, divine, and really powerful, really compassionate, fierce, a mother in a lot of ways. And she's been one of, I think, my greatest guides.
Wow. Yeah, that's I love hearing that. I've known this story, but I love hearing about the evolution of your faith and spiritual practice over these years. It's very unique.
Yeah.
And I'm excited to see what direction it takes over the next several decades too. I think that as you've immerse yourself in different meditation settings, and I have no doubt that's going to feature prominently over the course of your career.
It continues to surprise me. I'll say that every time I sit down to a practice. I think that's one of the joys of it, is the wonder, like the
Yeah.
wonder and awe of what can come up is amazing to me.
Sure. So that's a good point. So as you are discovering the wonder and awe revealed to you through your own meditation practice, you're also going through psychiatry residency at this point, I think.
Mhm.
And what are some of the more formative impressions you have of the world of psychiatry now as someone with some teeth in the matter?
Yeah. Let's see, your formative experiences of psychiatry.
Yeah, now that you're in the field and you're developing your own spiritual practice concurrently.
Yeah. Well, there's so many patient stories that come up, and obviously to protect some of those patients, I won't go into the details, but I'll say that one really unique aspect of of my psychiatry training is, of course, COVID. I was in the middle of my training right as COVID struck. I was on my consult psychiatry rotation. And so all of a sudden, I was being consulted on really palliative questions around COVID capacity and end of life. And I think that strongly shaped some of those situations, and patients are really, really stick with me for sure. And I think, COVID just affected everyone's mental health in such a profound way. And so there was, like, as themes, I think all of a sudden I was very aware of especially when you're a psychiatrist in COVID, we're sitting with patients in their own home, we're sharing a situation in the sense that we're all kind of stuck in our own homes, dealing with that together. So there's aspects that are shared that bring us together, but then there's these also dramatic disparities in how we're experiencing it, right? Like, I was doing psychiatry in Pittsburgh, and I was based in a primary care clinic in McKeesport, which is one of the most low-income neighborhoods in Pittsburgh, and a neighborhood that's been really ravaged by poverty and the opioid crisis. And so there was such an awareness of the differences and disparities that were shaping mental health treatment, access, and experience, really, through COVID and through all my trainings. That's something that also really sits with me, is and still is here in Philadelphia, of course, but certainly something I was and it was true even, of course, when I was in medical training, but there's something very different about being the treating provider and explicitly working on situations of mental health. And now your job is to try to coordinate someone getting access to a therapist and all of these things, and becoming very aware of how difficult it would be. Especially, I mentioned my own mental health struggles in medical school. I had access to so much, which was such a gift. So I think that awareness sits with me often, was how lucky I was by virtue of my position, some of the people I was connected to, and finances. My treatment, I still think about this a lot. My treatment was free during the entire time I was in school, and I had housing provided by the university, like situations and resources that very few people have. And I think about that a lot.
Sure. Did you, so as a resident, you did a lot of your clinical work virtually during the pandemic? Is that, I don't exactly know how psych residency was affected. For us, it was basically business as normal with just lower case volume. But how did that look like for you as a resident?
I think if anything, our volumes went up, and because, one, actually telehealth meant that some people who otherwise might have struggled to come into the office suddenly could come into the office, and other folks who don't have access to telecommunications, people with severe mental illness who don't have access to a phone or regular internet connection, were suddenly left out. And I think those disparities are something that we're still seeing in psychiatry. now even after COVID is resolved. But yeah, a lot of my work then during residency really transitioned to, if not, some clinics were fully tele or otherwise hybrid, unless we were, of course, inpatient, which was mostly, although we did some inpatient work by tele for a while there too. And of course, psychiatry has an advantage in that we can provide some of that care by tele, which has real advantages. I don't want to minimize how meaningful and powerful that can be for access, especially for some of our folks. But it leaves some people out. It's complex. It's a complex matter.
Yeah, just I can imagine how one of my favorite things about, or at least being a surgery resident during that time, is, I had to come to work and I had a team and people to work with and people to interact with and work together with. And so I don't think that I can imagine the challenges of residency are only made that much more acute by working in isolation.
Yeah.
And so I can imagine that must have been really hard, and something that I was, and my peers are sort of spared from by virtue of having to show up physically in person every single day.
Yeah, I think it was a real struggle for so many, and not just psychiatrists, but folks in mental
Yeah.
health. Because you're totally right. You're seeing these cases, often very difficult to improve, resolve, if that's something that you
Yeah.
used to being able to do, or because of situations, resources, systems, going to be intractable, and you're seeing them day after day after day, remotely in isolation. It's challenging for everyone, to say the least. And I was also really lucky to have some amazing friends in Pittsburgh and roommates, my roommate Alexis, who kept me sane through so much of that. And of course, I eventually met my husband, which definitely helped as well. But yeah, I mean, it definitely changes a residency experience for sure, that we're not meeting in the same way.
Yeah. I think residency without your peers is just, it's tough.
Yeah.
I can imagine it being a very isolating and challenging time for psych residents. So we've briefly touched on like what some of your professional interests are, but now you're year 2 of being a fully fledged, 3 of a fully fledged attending now.
Two.
So tell me sort of how your career has shaped over these last couple of years. What has interested you professionally? What do you want to spend the next, several years working on? You have a wide variety of clinical interests, which I think is awesome. And so just tell me a little bit more about, in your residency, I imagine the first choice that you have to make is, are you someone who likes that? Do you like the stabilization of an acutely psychotic person versus do you like managing people's chronic mental health problems over time? Maybe that's a false dichotomy in my brain, but tell me from that, how you navigated that choice to how you've shaped your career today.
Yeah. I think I always had a sense that I really enjoyed relationships with people over time, which is part of how I did the combined family medicine and psychiatry residency. And ultimately, I ended up completing, kind of did 3 years of the family medicine and then stepped over to psych only, which was something I was really lucky that the program was gracious enough to allow me to do. And I had interest in both. I definitely, and part of that is what I was describing earlier, this deep sense of feeling the mind and body is not separate in the way that they're traditionally. And of course, I think most psychiatrists wouldn't believe that either. It's just, I think some of these dichotomies still exist in the way we treat and approach these conditions for sure. And, but I was very, very fortunate to benefit from medical training and psychiatric training in the combined training program that I was at in Pittsburgh. And, but I ultimately decided that I really wanted to focus on the psychiatry side of things, but with an interest in how that affects medical patients. And so now my work here is with folks who have medical complexities. So I work in a med psych clinic where we work with a lot of folks who have different functional disorders, psychosomatic conditions, a lot of patients who maybe are coming with a really complex medical history and need medication management, but also folks for whom those are really genuinely intermingled in a complex way, like folks who've had trauma from being in the ICU or from their cancer treatments and infusions and are having psychiatric symptoms. And they're often they're patients who, some of them are patients, I would say, who they have a hard time finding a home between general psychiatry and the medical system. And it feels like they get left out. Some of them have chronic pain and conditions that are we're still really working out how to treat these patients best. And so it's a really interesting clinic. I feel like I'm always learning because it's so interdisciplinary. I'm constantly learning from my neurology colleagues, from folks in pain. I recently had the gift of working with someone to do some hypnosis training because that has some benefit. Like I think when you're doing that kind of work, it's really at the edge of what we know in medicine, I think I've had to challenge myself to really keep on my toes and learn from so many different domains. So it's a really fun, interesting clinic with some patients who are often really struggling. And then I also work in our women's behavioral wellness program here, which is a lot of folks anywhere in the reproductive spectrum with mental health conditions. So a lot of peripartum, depression, anxiety, things like that, but also menopause and perimenstrual. And then I work in the cancer program and I do palliative psychiatry. So work certainly around easing suffering and symptoms with the cancer treatments, but also work with survivors or folks who've had cancer in the past, but have psychiatric conditions that need to be managed. I work really closely with a lot of the oncologists in that work. So it's a really rich practice. I'm really like what in psychiatry would be like considered outpatient consult liaison psychiatry. So really intersectional, integrated, a lot of fun. And then I really enjoy doing psychotherapy as well. That's something that I was doing in my residency training. And I mentioned that, I have this like personal love of that world of meditation and therapy. So I'd like to think I'm always bringing that in when I'm seeing patients. It's hard to let yourself out. I don't think, there's some therapists who say you shouldn't let yourself into the room, but I happen to be of the philosophy that's impossible. And so I think I bring all of those skills in when I see a patient. And I'd love to do more of that. I think there's so much we don't know and understand. And I think there is such a wealth of treatments and approaches that are coming from not just medicine, and whether they're coming from meditation-based traditions or other mind-body traditions, there's such a wealth of stuff out there. It's hard to study them. That's one of the reasons why it's really hard to get evidence and insurance to use some of those modalities. So I think we need a lot more done in terms of studying, better understanding. And of course, the other thing I should mention is, of course, psychedelic treatments, which are right in there with all of that. Really, I think of those as like real mind-body based treatments, but using, in this case, medicine. So there's just so much we don't know, so much that's left to understand. And it's a lot of fun. I don't know. It's so much fun to be able to be at the cutting edge of some of all that.
Yeah. So Esha, tell me, for people who aren't as familiar with palliative care and end of life care, it's an interest we both share. And I'm curious what your impressions are of the need in that field, and specifically, what is it that we're not doing well with patients towards the end of their lives?
Oh gosh.
You and I both have a unique insight into this.
I'd love to hear your thoughts on this too, of course. What are we not doing well? Or your question was, what are
we not doing well? For people listening who've never taken care of a patient, with terminal cancer, with a very poor prognosis, who's grappling with chronic pain, depression, all the things that people struggle with really horrible medical conditions as they face the end of their life. What are we as healthcare providers, as physicians, as just, witnesses to their suffering? What do you think we could be doing better?
One of the things I think a lot about is I think we have a bit of a branding issue in palliative care. That's
Yeah,
part of,
the death,
yeah,
like a death consult team, right? Yeah.
and of course it doesn't have to be, or nor do I think it ought to be that. I think, and I actually was really lucky to have one of the palliative care attendings when I was in medical school tell me a little bit about the history of palliative care as a specialty, which really helped me understand why and how that came to be.
Yeah.
The palliative care came about from the 80s as we were starting to get more and more life-saving, life-extending treatments, things like ventilators and ECMO and all of these
Sure.
treatments. And you had a group of critical care doctors who were asking these really big ethical questions, like, does every patient want this? Is this really like in line with people's sense of quality of life and dignity? And so palliative care came out as a specialty from those conversations, from a group of providers who were really interested in meeting those patients with dignity and compassion and care. In having done that and having created a subspecialty, one of the things that happened was folks who had that training were having those conversations on these really interdisciplinary, incredible teams. And I think a lot of the rest of medicine got used to being able to point to a consult team and say, like, they do that.
Yeah.
Whereas like palliative care is really, it's not about just death and dying, it's about symptom relief in general. Which I would argue ought to be happening probably in all of medicine, in the same way that my personal belief is like psychiatry maybe ought to be happening in all of medicine, right? Like, all patients have a mind that is connected to their body, a body mind, all of them need that treatment. But we created a separate specialty in psychiatry from neurology. This is one of the things that medicine does, is like it likes to
So balkanized. Yeah.
so and so siloed.
Yeah.
Of course, our patients talk a lot about as a problem. And I think that very much can happen with palliative care too, is the conversations of palliative care can happen anywhere with any provider. Of course, having that specialized training is really useful for having those conversations in a thoughtful way. And do we want to make sure you have the time and space? I think that's actually the benefit of psychiatry or of palliative care, I think, is we have been given the gift of time and space to have those conversations. But often those conversations are best had with people who've been treating providers, actually, right? Like the critical care doctor who's been treating somebody with, or the oncologist who's been treating someone with a cancer for the last several years, or a primary care doctor who's been working with somebody with mental illness. They're often the best people to have those conversations. And so, I mean, in my ideal world, this is like so ideal, but I think, like psychiatry and palliative care are embraced as cultures and ways of being by medical specialties in general. And we have the time and space to be able to do all that, with maybe like folks in palliative care and psychiatry kind of guiding and leading the way a little bit, but really it being like being just a part of how we do medicine, is in a really whole person centered way, where you're not siloing. I think there are a lot of providers who try to do that too. I'm not like I've met oncologists who are absolutely having palliative care conversations. I don't want to imply that.
No, of course not.
Like there are people who do it.
Understand. Yeah.
But it's very much based on interest, which is interesting, rather than or based on disposition rather than being a kind of matter of fact.
Yeah.
There might not be an easy way to do that, right? Because we all do have different dispositions and different interests. I just argue that to not be doing some of that work when you're a medical provider or a primary care doctor, for example, is not is just not treating the patient in the optimal ways. And so, but there are pressures on all of those folks too, that limit their ability to do all of that. There's systems that make it really challenging. And yeah.
So I'm curious, Esha, I think, first of all, a lot of what you said resonates with me. And I definitely, I think palliative care is just something that is so poorly understood, not intentionally by a lot of people across specialties, but I think something that struck me early on as a medical student is just how divorced we are from death and dying, in spite of being in a profession that ostensibly navigates life and death. I think you can actually get through medical school and a lot of your training without having to grapple with death, which I think would surprise a lot of people in our field. But if you think back to maybe being an intern, your exposure or your involvement with an actively dying patient may be as simple as putting in a comfort care order and morphine drips, and then the next thing you do is you get called to sign like death paperwork. And so I think there's a real lack of it's possible to get through medical training without grappling with the reality of human suffering towards the end of life. It's easy to escape that. And I think you and I have both, because we have an interest in this area, have sought out independently opportunities to enrich our own understandings through chaplaincy work or volunteering for spiritual care services. But it's not a reality that a lot of doctors are all that familiar with, which I think would shock people not in medicine. But that was something that struck me, as we don't grapple with it nearly as intimately as I think people would assume.
I think that's true. And I think death anxiety is 100% something that drives medicine, right? Like,
yeah,
myself included. I think that's worth saying.
sure.
Like, I definitely felt like my early exposures to medicine were absolutely informed by like trying to process my grandmother's death and what that had all meant, and not really being able to get close to it emotionally. So using medicine is like almost like a dance of getting ever closer. I think you're right. I'm amazed at how people can avoid because I've at this point I'm like, how? Given the work I'm doing. But yeah, it's so instinctual. It's so human to want to avoid that.
Yeah, absolutely. Yeah. It's I didn't mean to suggest that it was anything negligent. I think we have this powerful drive to remove ourselves from something horrible as it's slowly unfolding in front of our eyes. So I understand full well why it's possible to get through, much of medical school and residency without having to really think too much about this. But I'm curious then how sort of through extracurricular or co-curricular, or you on your own time, have managed to learn more about palliative care and incorporate some of its guiding principles into your, in the spirit of making palliative care relevant to every specialty. Not everyone has the ability to rotate through a palliative care service in their training. So how did you come to you obviously rotated through palliative care, but how did you come to incorporate some of its guiding principles into your general psychiatry practice? And sort of how do you think other people could borrow some variation of its teachings in their own clinical work?
Yeah, that's such a good question. Another, just along with like the insight that palliative care, the history of palliative care and how it came to be, I also think in terms of like adopting and incorporating its principles into day-to-day life, I totally recommend routine awareness of reminding ourselves of death and dying, actually. Like the thing that we avoid, leaning into our edge and into those places of discomfort. When you realize it, when you sense it in your body, deliberately noticing that and leaning in, whether that's to get closer there's so many books, film, literature, like so many people grappling with it that it can be close to, like, beautiful to approach and through all of those means. TV shows, there's so much out there, but I also think like certainly people, like you and I are both interested in the chaplain volunteering. I think like to volunteer with those chaplains
Yeah.
to get close for sure, or in a hospice setting. And certainly all of us will experience death and dying. And so when we, whether it's with our family or families or loved ones, and so when we notice our own discomforts, or friends who've been grappling with it, to notice our own discomforts around that and to be able to name them openly, I think is a really good first step. Like, wow, I'm really, I think I have to grapple with this a lot with my patients, of course, like my own discomforts around, I don't know how to deal with this situation. And sometimes it's as simple as naming that, like, wow, I am realizing I don't have anything to say here. That's a humbling thing to acknowledge as a doctor, but
Yeah, of course.
I think that's one of the gifts of this work, is sometimes just being like, wow, I really don't know what to say.
Yeah.
I'm floored by what you're going through, and I'm not sure I have anything to offer, but I'm here with you. I think
Yeah.
just presence, the gift of presence with people and with ourselves when we're going through that, is a really good place to start. Noticing where we experience discomfort and leaning into that a little bit, especially if we notice it.
Is a lot of your palliative care work and interest cultivated through cancer-related palliative care specifically, or is that the setting in which you have sort of been clinically involved in palliative care work?
I think probably the most explicitly, but I think it absolutely comes up in my med psych clinic. And if all of medicine actually involves really grappling with questions of death and dying, then it comes up everywhere. It comes
Everywhere,
up with my therapy patients.
of course.
Comes up It comes up in my conversations with my parents and my family. It can come
Yeah,
up, we just don't like to.
of course, it's uncomfortable.
Yeah, I think somewhere along the way, I almost, it's funny thinking about this, but I almost feel like I notice when I experience like discomfort and it gets exciting to me. That's like my personality. It's like, oh, there's something new here. And then so that's how you end up being this kind of person. Like getting kind of excited by those moments of discomfort and be like, wow, I was really, because
Yeah,
they're so valuable as moments of learning about ourselves.
of course, of course. And and the truth is, nothing prepares you for some of the things you see in medicine. The advanced cancer in 20-year-olds will just never.
Yeah.
Yeah, I think 5 years into residency, it's something that I'm still working on.
Okay.
But you mentioned briefly psychedelics, and that's a very exciting new field in a lot of psychiatry. I'll profess to not know very much about it, other than a lot of people are talking about it and are excited about it. Tell me, is this within the realm of palliative care in particular, or treatment refractory mental illness, or what? Tell me what you're interested in that vein.
I think it's being used and explored. I'll acknowledge I am not by any means an expert either in psychedelic medicine. I'm just starting to work with some folks who are, and collaborating with them for some of our patients, especially at the end of life. Of course, that's where it's been really well studied in the palliative care setting, is at the end of life. And I definitely have patients who come to me asking for either, I can't prescribe psychedelics, obviously, but psychedelic assisted kinds of therapies and guidance around a psychedelic. And some of them are obtaining it for themselves and using the medicines at home. Some of them are working with psychiatrists or providers in the community, and there's every mix in between. Yeah, it's really exciting. I think for me, with particularly my background and that interest in presence-based work, psychedelics are really also a way to be present with someone through what can feel like a microcosm of life in some way. Like the trip is can be such a, again, a valuable window and insight into our minds, into what matters to us, and parts of ourselves that we may not have realized were there. So I think there's just really rich healing potential, especially in psychedelics with psychedelic assisted psychotherapies.
So, Isha, where have psychedelics, sorry, been approved? What are their indications now in psychiatry? Is it uh, like cancer pain, or what's closest to being approved, if anything?
Good question. So for some, I think right now, ketamine for treatment-resistant depression is one of the only few approved, and this
Okay.
this is changing on a day-to-day, week-to-week basis. So I'd have to like double check this, but
Sure.
and then MAPS, which is one of the great one of the few places which coordinates studies in psychedelics around the country. They're approved to do RCTs and things like that with other psychedelics. And so if you
Okay.
have they can perform psychedelic assisted psychotherapies for other indications. And they're working with things beyond ketamine. So they work with psilocybin, MDMA, and lots of other things in between.
Interesting. So can you explain for people who might not be as familiar with how we treat pain, for instance, what is a patient with chronic cancer pain? What are their options right now? And what are the challenges that in managing their pain towards the end of their life? And what role do you think psychedelics could play one way or the other?
Yeah.
Because in my world, that's like something we see all the time, and it's absolute for someone who has never seen someone in the throes of just debilitating, excruciating cancer pain. It is a horror and hell like no other, and we have got to do a better job of taking care of this patient population as providers. So I'm all ears. I would love for patients who have bad cancer not to suffer in the last couple of years of their life. So
Yeah.
I'm curious what your thoughts are.
Yeah, there's like to plug a really good guide on how to treat cancer-related pain. The University of Wisconsin-Madison, I believe, has a resource called Fast Facts, which is like available for any physician to access resource on palliative care. And they have articles on treating cancer-related pain that will go through all the evidence-based options. So we use, of course, opioids, which are, they have a bad rap for a lot of really good reasons. They can obviously be addictive and have catapulted us into an opioid crisis, but they're also really necessary medications for end-of-life patients, and especially for cancer-related pain. And then, of course, we use other things like antipsychotic medications, benzos, all of which are appropriate to use at the end of life for alleviating pain. Other medications like SNRI, serotonin, norepinephrine reuptake inhibitors, things like Cymbalta and Effexor. And then, the resource there will kind of really nicely fleshes out, I think, a host of other things that maybe we don't think about that you can also include in that. And then I absolutely think psychedelics play a really important role in relieving suffering. I think the suffering there, it interacts with pain, but it's also very existential. And those are really difficult to tease out, but I think the existential dimension of cancer is one of the things that we definitely don't treat very robustly in medicine, unless you're an existential psychotherapist or like a handful of people who think about this really. It's absolutely something I see a lot in the work I do. And so that's when you mentioned like what are other places where I've really like tried to educate myself. I think actually in existential psychotherapies, people like Irvin Yalom, and because it is such a part of the work I do.
Yeah, actually, can I clarify that with you, Isha? Because that was going to be one of my follow-up questions is, are psychedelics in chronic, cancer pain patients, is there benefit derived from their analgesic effect, or a conscious altering, I'm sorry, I'm not articulating this well, effect? What is the benefit to them there?
Yeah, it's a really good question. I think we're still really understanding
Sure.
this.
Yeah, I can imagine.
How psychedelics work, I think, and the mechanisms of action is one of those things that's really being studied. My sense is that both really is the answer. I think there are some psychedelics like ketamine that absolutely can have an analgesic effect. Like I've definitely had patients describe reliefs of pain, which has to do with, and of course, because the mind-body system is tied together, it is really actually profoundly difficult to tease these apart. When you have mind-altering experiences and changes in perception, they'll change how we perceive pain too. And when you have relaxes in the physiological state of the body, that'll change the upward sending those other signals to the brain from the bottom up as well. So there's top down and bottom up changes happening probably with psychedelics, makes sense. I think things like psilocybin, from my understanding of the literature, what we've used it for in the studies so far has been a lot of relief of really like spiritual existential concerns at the end of life. But I would not be surprised at all if it has analgesic effects as well. Because of that really close relationship between them. When people can interpret their pain very differently, it dramatically changes their experience of pain. And there's some fantastic, I think, folks in the world of pain psychology and pain physiology research who are trying to better understand this as well.
I would imagine, Isha, that if you're studying psychedelics for something like treatment refractory clinical depression, then you're relying more heavily on its consciousness altering properties of the pharmacotherapies of those drugs. I don't, but there must be some analgesic property too, I guess. It's fascinating. I profess to know absolutely nothing about it other than anything that could get some of the horrible cancer patients I've had to take care of, anything that could get them more comfortable is something that we should absolutely consider studying more intensively, because we're falling so short with this patient population. It's just agonizing to watch sometimes.
Absolutely. Yeah, I think in treatment-resistant depression patients, I agree that it seems to be the more consciousness altering side of things that is like the reset, so to speak. And it's worth saying, like, we don't fully understand how ECT works yet.
Yeah, interesting. Yeah.
This is like a functional reset, really, like for people with depression, treatment-resistant depressions. And so I do think of psychedelics as being somewhat similar, but I think we have we're just going to learn so much more, and yeah, I hope in the upcoming decades about what's actually going on there. I think it's going to be very rich and interesting, because one could imagine like there are maybe pain perception centers in the brain that are centered around mood that are also being altered. Like there's physiological states of pain that are I just think there's we have so much to understand. It's what I'm going to boil down to. There's so much we could understand and talk about there, but
yeah, I think you and I both, if we had had the chance to, complement our sort of Western allopathic training with, either something like traditional Chinese medicine or Ayurvedic medicine, I would have been so interested to explore how other cultures interrogate this mind-body dualism in so many different ways. But unfortunately, I don't think either of us wants to do medical school again.
No, I don't think we have to. There's you can absolutely be informed on all of that.
Yeah.
Like, I think my explorations in like meditation are 100%, they're just so stolen from from India, and from the East. And I think it's amazing to be able to draw on all of those and then see those coming into Western therapy.
Yeah. So tell me, what are you actively involved in any sort of trials with psychedelics in patients, or you're just at the phase of your career? I mean, you're still building your own clinical practice now, so I don't expect you to have it all figured out just yet. But
You to do another thing.
another thing. But is that's something that you clearly are interested in pursuing professionally? And
I think I'm not totally sure, but in like where my career will intersect with psychedelics per se, I'm definitely interested in being with, I think the part of me that is really enjoys being present with patients is excited about guiding people with psychedelics and using the medicines there to hopefully just get traction in ways that are like the medicines we have so far have just not been able to do, and in places that we haven't been able to do it, like the end of life. So I'm really excited about using them. Studying them, I think, is also really awesome and exciting. I just think there's only so much I can do in my career, so we'll see how much I get to do.
You're very busy.
Yeah.
Tell me a little bit about, you have an interest in global psychiatry,
Mhm.
dating back to medical school, I think. So tell me a little bit more about that.
Yeah,
You have been talking about psychiatry in a strictly Western context. And I
yeah,
think psychiatry is one of those fields where culture is just enriches the discussion and muddies it in so many different ways. So
very agree. I like that characterization of it too. Yeah, I mean, I think my work in global medicine kind of goes back to growing up, going back and forth to India, and being so shaped by the experiences of, especially in India, there's places where poverty isn't happening, but as it turns out, the places where my family would often travel, I think we saw poverty routinely.
yeah.
And I think that really shaped an early curiosity about international development kind of work and how to relieve poverty and what the relationship is between poverty and health, which of course I think is something I still maintain a really strong interest to this day in. Certainly something that came up in my residency training, working with those folks in Pittsburgh, and of course here in Philadelphia, which is one of the poorest cities in the country. And so my curiosity in this now is, well, I think the world is changing, and I'm definitely growing more and more interested in policy level interventions at the level of things like cash-based transfers, universal basic income, and the relationship between that and mental health.
Mm.
I think we have to start thinking about that more and more, partially because I think my sense is that labor in America is about to transform pretty dramatically with AI.
We need your husband to
Yeah,
talk.
my husband is thinks a lot about AI, and so I get to think about it with him, which is really interesting. And I think really shaping, it's interesting how his work has shaped my work too, of
Yeah,
course, as happens.
yeah.
Uh,
Hope to talk to him soon.
yeah. I think that'll be a really rich conversation that I can't wait to
Yeah.
I can't wait to hear as well. Um, so yeah, I think because of all of that, I'm definitely curious about policy level changes, both at the international setting and domestic setting, that will shape mental health in the future. And my sense is universal basic income like interventions or cash transfers are going to have to be a part of them. And better understanding, especially when we think about poverty and resource allocation, understanding how effective are those interventions. So that's a kind of strand of my research that I'm currently pursuing here as well.
And so then, sorry for a stupid question, but then to spell it out completely, it's the advent of AI that will take jobs away and make something like universal basic income become more relevant over the next several decades than ever, right? That's what
I
that's
think yeah, I mean, I think there were people who were definitely thinking about universal basic income well before AI, but I think AI and its like effect on the labor economy right now means that people who maybe weren't thinking about universal basic income before are, I
starting
think
to.
we start thinking about it, because like our understanding of labor is just, I think, about to change really dramatically.
I mean, how we as
It's
humans,
something we don't want to think about too much,
yeah,
but
yeah, it's strangely terrifying to think about how we would structure our time in a world without employment.
yeah.
I don't actually know what I would do. Uh,
And health in this country has been so formulated around
yeah,
having employment,
yeah.
right? Like the entire employee-based insurance system in America. So we've tied health and employment together in
So
America for so long. I think other countries actually have a more straightforward, they've been thinking about this,
yeah,
are doing universal basic income interventions I'm thinking about particularly social democracies
sure.
like the Scandinavian countries. They've been thinking about this for a while. I think we're going to have to start.
Hmm. And so is this universal basic income targeted at reducing the burden of chronic mental illness, or what's maybe you mentioned it and I just missed it. What specific psychiatric targets or outcomes are you trying to improve?
Yeah, I think of it as like actually questions across the board about multiple parts of this. So certainly how would something like, first of all, how much money, where, to whom, where of course is the money going to come from? Like, is it actually the most cost-effective intervention? Are there other ways to do those kinds of interventions? Should it just be cash? Should it be cash with like structured around incentives to participate in certain behaviors, or conditional in some way or versus unconditional? I think these are all questions that researchers in this field are asking as part of running trials on these kind of things. And in the world of resource allocation, also like in the question of to whom, it's like, I think those questions also start to change with culture. Like different amounts of cash work differently in different cultures. Cash, those kinds of cash interventions mean different things in different cultures, and they'll have different effects in different cultures, depending on purchasing power and economy. And so there's a whole economics, I think, angle to this that's just going to have to be understood over time. But yeah, I think questions about like prevention of mental health conditions, like you said, when health and employment are tied together in such a deep way, how do we keep people well from like a preventative side with universal base income kind of interventions, but also how does it interact with people who are coming from different phases of life? Like, what does a cash intervention mean for somebody who's got an ongoing addiction?
Yeah.
What does it mean for people with different chronic conditions? What does it mean for people who are at the end of life, who are caregivers, who are, and so those are all, I think, really rich, interesting questions that we'll have to better understand, because it'll determine probably policy level allocations of these kinds of resources.
Yeah. I'm curious, that's a nice segue, Isha. You and I are both, you're more well-versed in a lot of Jonathan Haidt's and Greg Lukianoff's research, but
I'm not sure.
there's an what's that?
I'm not sure about that. I'm not sure I'm better research.
You at least have more exposure to the burgeoning mental health crisis especially among American youth.
Yeah.
Although certainly across youth in industrialized countries right now.
Mm-hmm.
I'm curious, as a psychiatrist who takes care of these patients, this is your bread and butter. What is your impression about what's happening to young people in America today?
Yeah. Well, I think Haidt, if folks haven't checked out Haidt's writings on this, he's keeping a blog where he's regularly kind of writing about the data around it. And I haven't been following it as closely as I would like, but I think it's undeniable based on the data that we have right now that the rise of social media has, at this point, like, I think pretty definitively played a major role in the rise of a mental health crisis in adolescence. I think there's still a lot that we have to understand about exactly the mechanisms and how, and I'm, but I don't think the data at this point, from looking at the data he's provided, I think it's pretty undeniable.
Sure.
And,
I guess you don't take care of pediatric patients. You're seeing young adults in their 20s and 30s at youngest, right?
I did some child psychiatry before, and I guess I have like watched a transition of like folks who are in middle school, high school, like
Yeah.
losing their teenage years to COVID and the combination of like COVID meets social media, and now struggling as young adults. But yes, I'm definitely seeing them more as adults. And of course, anything that's children and adolescents pick up their habits from and take guidance from adults.
Yeah.
So I think we're seeing very similar things actually in adults as well. It's just adults may have a better, like more developed prefrontal cortices to be able to regulate themselves around things like social media. And of course, I feel like I've ranted to everyone about my like the way that I personally use tech because
Well, that was going to be my follow-up question, because I think
Yeah.
what you've done is really important and very instructive to a lot of people.
I think I talk about it a lot because it was so transformative.
Sure. So Isha, tell me, how have you regulated tech in your life?
I mean, I got off all social media, and that was, I think, really a great decision. No regrets whatsoever. But beyond that, I also we read Techno Minimalism, which is a book by Calvin Newport. He's a computer scientist, and he writes for and argues for principles of minimalism in the use of tech. And what that means is asking questions like, what is tech the best tool for accomplishing this end and being very intentional about how we use technology to meet our goals in day-to-day life. And when tech is not actually necessary, choosing not to use the tech. And so for me, that's involved actually probably really robust like tracking of how much screen time I'm getting per day. I obviously have to use my phone to some extent to take care of patients, but I really am, I think it's an ongoing effort because it is such an uphill battle, I think, with smartphones today. But I really try to minimize how often I'm checking my phone, my email, my text messages, to schedule it as much as possible, to minimize my screen time in general. We of course do like borrowing on the Sabbath. We do a no tech Saturday, which all our friends know about because we're hard to get in touch with and things like that. And I think all of those little rituals around minimizing the use of tech when we can, also not avoiding use of tech after certain hours at night, all of those things, I think they have been instrumental to my mental well-being anyway.
You should remind me though, there was a system of purging that you went through.
Yeah,
Like,
we did like a 30-day cleanse.
30-day cleanse, if I remember correctly.
Yeah.
What's the Cliff Notes version of that? Because I sort of saw you through before the cleanse and then during the cleanse, and now I've seen you and your husband after the cleanse, and explain what that was like. And then, like a lot of cleanses, they can be self-limited and you gain back all your weight right after, and sort of what have been the most salient features that you have maintained since your cleanse ended?
That's a really good question, and like good motivation for me to like
Keep it up.
keep it up. Yeah, absolutely. I mean, the 30-day, like, I think he calls it like a detox, or I'm not sure exactly what he calls it, but is really not using tech unless absolutely necessary for your job is what he advocates for in that period. And it was so eye-opening, like the amount that I compulsively go to my phone, just the amount of screen time that we have per day, the amount of times that I was tempted to pick up my phone and to use it, even in like ordinary scenarios, like being in the elevator.
Yeah.
Those empty moments in time and presence that we fill up by looking instinctively at our phone. He argued, I mean, that in that cleanse, you become aware of all of it. You become suddenly very aware of all the times that you do that. And one of the things I think my husband and I, we also of course stopped watching any TV or and the things that we kept were we do still watch some television, but we only watch TV together, which we realized each individually that TV was just way more fun when we watched it socially and together, and watching it individually often had the property of quickly slipping into something that was more compulsive and actually just less rewarding. And so, yeah, as part of a techno-minimalism, you're also asking when I reintroduce the tech, how do I want to reintroduce it in a way that supports my well-being? And that was one of the places where we reintroduced some tech. One of the biggest
things together.
Right. Okay. When we watch things, only watching things together. I think one of the other big takeaways from his model there is it's not just reducing tech, it's really coming up with like a supportive structure around what are you going to do to fill all your empty time? Because it turns out when you take away like 4 hours of screen time, the average is like 4 to 6 hours. It's quite a amount of time, myself included.
We're casting stones here.
Right. All this free time, and there are people who've definitely developed very rich lives in terms of hobbies and other things. I think I definitely needed some help with that. Like I needed a plan for what I was going to do with all that time, and I think that's one of those places where I'd like to get back on the wagon a little bit. I absolutely think of it like an addiction. There are clearly dopamine pathways that are being on high, like just rung when I am around my phone and when I'm able to use my phone. And I think they were designed to do that, like absolutely part of the principle. So yeah, I'd like to resume some of my better tech habits that I think have slipped a little bit.
Yeah, I want to spend more time talking about this in particular because I think everyone is going to have needs to seriously rethink their relationship with technology, myself included, especially kids growing up. I mean, you and I grew up, were at least had childhoods before the iPhone, right? No other, we're like the last one, I think. And so being really thoughtful and intentional about how we personally use our technology is something that you've thought a lot about. And so I want to hear more about this from you. What was the first, during the beginning of your 30-day thing, what was the most noticeable effects it had on something like your mood, for instance?
Yeah. I think actually one of the most obvious things was how much my husband and I connected more after we both started, because we were doing it together, right? I think I started doing it first, and then I think he just realized, I think I just like talked about it enough. Like I annoyed him enough about it. I was like, you need to do this with me.
Yeah.
And then we started doing it together. But I think even on my own, the amount of free time, the amount of spaciousness, like I think there was a story of like how stressed out I am by all the things. And it was really my own compulsions driving me back to this constant source of information.
Yeah.
And when I was able to step away from all that, it's like, oh, there's so many of these moments of just like presence available. There's so many of these moments of just like more time to meditate than I realized. There's more time to do all the things. Also, the amount that I connected to random strangers really went up. Like all of a sudden, I'm not using my phone in the elevator or in all these random moments in line. And the airport is one of the most amazing places to, because at this point, you can go to the airport and realize like it's all anyone's. Yeah. And you actually notice the rare person who isn't, and
you become friends.
You lock eyes and you realize your connection of like.
Usually they're like a Jehovah's Witness. I want to talk to you.
I'm a little more what's the word? Proselytic? Is that the word?
Yeah.
About this.
And the Jehovah's Witnesses.
Yeah. It is really amazing, like how ubiquitous it is right now. To be one of the few people who is not on your phone it's a rare treat. And the amount that I feel like I connected in general to people, to myself, to nature, to my environment, just noticing beautiful things in the environment that we miss every day because we're so back to the phone. All of that I think had a really measurable effect on my mood. Yeah.
I think it's interesting. I've heard a lot of people defend what they consider to be more innocuous uses of screen time, like what's wrong with scrolling through adorable animal videos or travel stuff on Instagram and seeing beautiful places around the world. But I really don't think there's innocuous social media usage like that. And so I'm curious if you had any experience that would suggest that we actually do better when we scroll aimlessly looking at cute puppies or beautiful destinations or something like that.
That's a good question. I think the key was it intentional, actually. The danger of it is so easy to not plan, not intend, to just suddenly be doing it. And then you're losing out on all those other things that I mentioned, whether it was hobbies that you planned intentionally or relationships or being present with people in your life or the environment or nature or strangers. I think like planning and intending to, like, if you schedule out, like, I'm going to spend an hour scrolling through dog videos because I feel like I really need that. I think that's a very different exercise. And it's worth saying, like, even that for some people, and because I do think there are people who have different dopamine pathways who are wired different. There are going to be some people for whom that is not a good idea to ever introduce into their lives.
Yeah.
Because we're all wired differently. But for some people, I think it will be useful to have moments where we're able to scroll through something or, and there is really value, like, this is not to negate the power and worthwhile uses of the internet. Sometimes we need to search for, it's such a source of information.
Yeah.
And like necessary in a lot of ways for my work. Especially when you're in psychiatry, so much of where I find guidance around what's working for patients is in the realm of things that are not, they don't have like ironclad studies, is actually social media sites. Like patients are brainstorming and collaborating around how to gain access to treatments and what's working for them and what isn't. So I actually use, like I go to some social media sites, not with a personal profile, because I don't want a personal profile on any of the sites, but I totally go looking for interesting novel sources of like information, inspiration, and treatment for some of my, and to get a sense of like what's working for people out there. So there are really it's all to say there are really skillful uses of tech. I think that's the key. Is it skillful? Is it intentional? Is it truly what you need to be doing right now? Is it some of those like really basic questions around like, is this the right use at the right time for me? Is really what I think it's about. And I think that at least for myself, I'll speak for myself, I don't think I was doing that nearly as skillfully before. I think when it was my default mode, I was far more likely to use it in a way that was not skillful.
Sure. What I can imagine though, for a lot of people, cutting it out the way you did at the beginning would sort of precipitate an existential crisis of sorts. You're now left alone, unfettered, just you and your destructive thoughts. And suddenly you have things, you have to decide about what you're going to attend to.
Yeah.
What was that like for you? You're very well regulated and disciplined. I think you have an unusual, we've talked about this before, but I think you are not someone who's prone to cravings, who's prone to falls prey to sort of addictive impulses very quickly, very easily.
I think that's true, just from my having watched and seen other people. I think I'm somebody who, fortunately, is not prone to. I mean, I think we are all prone to addictions if you put the right substance in the right brain.
Yeah.
But I've been fortunate to have avoided, besides tech, which I absolutely think is addiction for me and can be addictive for me. I think I've avoided most other major addictions. I think, like, to so you're asking.
Oh, my question was just, what was it like? What was that initial purge like for you psychologically? Was it, did it precipitate like a anxiety, depression before you figured out how you were going to navigate a world where you didn't have a constant source of distraction in front of you? Were you immediately relieved? What can people expect who cut out tech so readily on such short shrift?
It's a good point. I don't think for example, the book talks about like all the things you might be avoiding with the tech that will suddenly maybe come to the forefront. I think in my case, I was fortunate that I don't think I had any dark like things that immediately were right there that I was avoiding with the tech. The tech was just a distraction. I sometimes actually I use tech to avoid feelings of loneliness, which I don't think is common. So I'm way more prone to using tech when my husband's away, which is something I've learned over time because he's such a source of comfort and company. And so when he's not around, I'm like, I gotta really step up my I have to do really deliberate planning to see my friends and going to events, and because he and I are such a source of company together, we do so much together. So there was an awareness around that. I think that's the biggest thing I think I noticed. Like when especially if he's not around, the tech can sometimes be used in place of feelings of being alone and longing for company. And so finding ways to connect, if that's what my body mind is longing for. I'm imagining for other folks though, the tech just like meditation, right? Just like the practice of suddenly sitting with and not interfering with our own minds, which can be a really intense exercise. Sometimes tech is being used to avoid something. And I think in the short term that can produce more distress. And so I don't think that's something that he talks about as much in the book, but I think it's worthwhile to think about. Just like with any addiction, I think people are in a really vulnerable place when you take away their addiction of choice, whether it's a substance, a drug, or a habit. And it's really important to have support around that. If you've been using it in a way that where there's avoidance of something else, making sure you have a good therapist or some kind of support network there is essential, just like it would be for any other addiction.
And so then over the month then, you did you feel any different, or was it only looking back on your 30-day purge that you realized all the benefit that you derived from this endeavor?
Did I feel any different during the 30-day?
Yeah. Yeah. Yeah,
Very,
you did. Immediately.
yeah, within 2 days, you'll notice, which is, I mean, I, when was the last time I went a day without my phone at all? It's actually been a minute, and it's a reminder that I think life is different when it's not even something that's available, which is basically the case for that purge. And yeah, it felt immediately different. It felt like immediately I had so much more time and space and presence. It's pretty remarkable when you take away something that has been a source of addiction and it's no longer available. I think people can notice the effects pretty quickly. It might be one of the single most like I think sometimes people come looking for like like solve my problem to a
Yeah.
psychiatrist. Give me a pill that'll
Yeah.
make it all better. And I'm like, I don't have that. But if you, one of the things I joke with a lot of people about is like, if I had a pill that could do what exercise does, I would be the wealthiest doctor on the planet, because exercise is one of the single most powerful interventions to improve mental well-being. Meditation is extremely powerful. I think if I can give people a meditation practice, although that's something you have to cultivate over time. So that's certainly not an immediate fix, but I think people can notice effects in as quickly as a couple weeks with a meditation practice. And then, like, I think taking away tech at this point is one of the quickest, unless you're somebody who's using it to avoid, or there's other stuff going on. I think one of the quickest things you can do to improve your mental health. And I think especially social media, actually, other tech, I think, can be really fruitful, and it's all about those uses. I think social media also can be very productive and fruitful for some people. Again, don't want to imply that it's not for, I think it is all of those questions I mentioned earlier. I think especially for teenagers though, like the proof is in the pudding as far as how much it's negatively affecting their mental health, sense of self. Like there's just aspects of compare culture and things like that are clearly brought out by social media in particular. And so, yeah, I have zero regrets about personally having completely stopped using social media.
Yeah.
Great decisions.
Yeah. And so then, Esha, now what is your ideal relationship with technology? You're off social media. You limit yourself to a set amount of screen time a day, or what is?
Yeah, I try to be under an hour. I try to really limit the use of my phone and keep work on a computer or desktop. I try to limit my checking. I think the place where I'm actually maybe the trickiest for me is I enjoy texting with friends and being in touch with friends. But I think that's for me okay. I personally would like to come down in terms of how often I'm checking my phone for texts. I do keep my phone on like a do not disturb through most of the day. And I have you can use your iPhone and play with the settings, so you can only allow certain texts to alert you. So I allow my family and my husband and some of my friends to have immediate, like they allow notifications, but I do turn off all notifications otherwise. So I'm not really distracted by the tech.
The black and white screen. Don't forget
Black and
that.
white screen, yeah.
That's amazing.
Hashtag
Yeah. I mean, I think that is such an easy thing
Yeah,
to do. And I mean, it really shows how the bright colors and just
yeah.
enchant you.
I think I don't know if there's data to support that, but I think Leo was the one who told us
Yeah.
like it's like your brain searching for that bright red tomato in the desert, and so try changing it to black and white, and it does make going to the phone much less appealing. I use an app that called OneSec that anytime I open my mail or my browser forces me to take a deep breath and to state what my intention is before I use them.
Oh, wow.
It's really annoying and therefore very discouraging of use of tech. Yeah, there's lots of, so I think between my husband and I, we've done, and then he uses an app called Freedom, which like dramatically like allows him to regulate his use of a lot of other things as well. So there's lots of tools out there for people who are interested in it. And I'm happy to brainstorm with people. I also highly recommend people check out Digital Minimalism, the book, because I think it gives a really nice framework for what to expect. And yeah.
Yeah, I think we've talked about this before, but I think I think addiction is something that we both have interest in, and it's just fascinating how I think technology is the addictive frontier that everyone is going to grapple with if they have not already.
Yeah. Think about this with AI a lot too, actually. Like, it's going to change the world of addiction. It already is. Like, you can now personally make your own little fantasy of thing that will draw in your dopamine. And I mean, I'm using AI-based tools for some of, like, for writing and for things like that at times, but I'm definitely keeping like a cautious eye in relationship to all of that.
What are some of the early AI and psychiatry news on that front? Is there anything that any AI either data driven, or is there anyone doing interesting AI and psych research that
That's a really good question. I'm sure there are.
yeah
I don't know folks off the top of my head. Here at Penn, for example, I think there are people who are thinking about AI in healthcare in general, like for diagnostics. I don't. I think you're definitely seeing AI-based therapeutic tools being developed. Like, one could imagine personalized cognitive behavioral therapy, personalized therapies using a chatbot. So there are definitely folks doing things like that. I don't know if anyone has, so the bigger picture questions that I don't know that folks are thinking about, that I would love to see people think more about are, well, labor. Like, how is AI going to change labor? And
yeah
what does that mean for mental health or health in general? I think right now we're in a phase where we're so excited by the benefits it offers. Some folks are definitely thinking about those bigger picture questions for sure. But I would love to see more people in medicine thinking about that, like thinking about AI beyond just how is it going to serve our advancing healthcare. I think thinking about it even more holistically around, like, how is this going to change society and labor and poverty and inequity. And then, of course, my husband thinks even more broadly about, like, again, existential threats kinds of things with AI, things that other people may not have on their radar, but biosecurity, the threats of the AI poses in terms of international security, some cyber warfare, some of these really, like, actually potentially civilization disrupting effects, and beyond that, like AI alignment kinds of problems. I haven't seen too many people talk about that in general in healthcare yet, but I think of it as, I think you and I have talked about this, like, I think of it as like the next frontier of, there was Physicians for Human Rights and Physicians for Peace organizations around nuclear weapons and nuclear weapon non-proliferation movements
yeah
that came out in the 60s and 70s. And I think we do need a more physician-based,
Mm.
I think it'd be exciting to have more physicians thinking about this, because we are powerful in our voices and we have an impact. And I do think we need more people thinking about those downstream things.
That's fascinating, Isha. What do you think are some of the things we should focus on if we were to convene a group of physicians worried about the future of AI?
It's a really good question. I think
We'd have
raising,
to mitigate the existential threats that are already being discussed somehow. Like, what do we do?
yeah. I mean, I think we could model off of something like the non-proliferation, nuclear weapon proliferation movements, which were a lot of, like, physicians, I mean, going to meetings like at the UN and in the US government and speaking more forthrightly about our concerns for human health. One of our goals is that we can be voices for human well-being and human health in general. That's an angle and perspective on the problem that is, I think, different than maybe like technologists or folks like in tech-based companies. They have a unique perspective that's not to be missed, but I think the human health-based perspective and human mental health perspective is just a really important one. And so Yeah, I think a lot of it would be like advocacy and educating ourselves on what's ahead. Um, and of course, like how our uses of AI might contribute or feed into the problem, or how we can mitigate that at the level of the ways that we are integrating AI. So, for example, even in like, this is not even thinking too far down the road, but even right now with AI-based mental health tools, how is an AI, like, you can absolutely set up an AI to screen for things like suicidality, but what, like, there an AI could definitely, based on the data it's receiving, like end up giving people
Mm,
untrue information or non-therapeutic information that could worsen mental illness. I think those are really potent concerns that people need to be thinking about if you're going to be using an AI for therapy, for example. And so how do we mitigate an AI? Because AI right now it's based on the data that it receives. We know that there have been, certainly there's people who are thinking about like racial disparity kinds of issues with AI. All of those issues that are much more like local, I think are going to come up in mental health, for example. And then there's those bigger picture existential concerns as well. I think that it's going to be, it's and I don't know that there are too many folks right now in psychiatry thinking too robustly about it. Again, this might be us not wanting to.
yeah, like avoiding death.
Avoiding death,
Yeah,
yeah.
there's there's existential reasons to avoid both of these topics.
They really are, I think.
But I love that idea. That's a fantastic idea, Isha. I nominate you to chair this effort. Uh,
I hope it comes about. I don't know if it'll be the chair, but I'll definitely partake.
no, I love it, and I think I don't know that physicians have always organized themselves well. I think people think we're better organized because pharma is a monolithic force that everyone sort of knows about and is uniformly wary of. But like physicians themselves, I think haven't always organized themselves effectively. I guess part of it is a time constraint. The other part of it is, I guess, lack of experience, maybe. But there's definitely instances, I think, throughout American medicine where physicians have. But I think when people think,
Very
what's
well
that?
organized. The American Medical Association was very well organized in advocating against like universal healthcare. Back
Oh,
when it serves our benefit, we are remarkably well organized.
I guess that's true. Yeah. But that's a fascinating thinking about a physician task force specifically convened to address and be very thoughtful about some of the risks that AI misalignment poses to human health. I think would be an interesting endeavor.
There are definitely some, like, again, mostly in the realm of like effective altruist organizations working with physicians who are definitely thinking about this as well.
Yeah. Something to think about. All right. So you're 2 years into being an attending, Isha. You have just about every interest in the book. In a way that I think is mutually reinforcing and enriching. I don't mean to imply that you have disparate interests that are not related to each other. I think if there's one person who can make all these things intelligible, it's you. Um, what do you want to focus on the next couple? Let's say the next decade of your career, and then maybe long term after that. Where do you want to take? You have so many different interests, and I think I think that one of the more unique things about you is you have an incredible passion for patient care that I can't see you relinquishing in the face of all these competing interests. So how do you, and you don't use text, and now you have more free time than everyone else. So
I'm amazed by where that free time goes, and some of it's definitely going to my iPhone. So, but yeah, that's a really good question. I imagine I totally agree with you. I think there's a part of me that, as long as AI doesn't take my job, I will always have a part of me that really enjoys working with patients, and yeah, and it's such a gift to be able to do that. So if I can continue to do that, I'd be very grateful. And I'd like to continue learning in the worlds of like therapy and meditation and bringing those more into my work. I think that would be really exciting. I'd love to teach some of those more, I think, robustly too. Like, I definitely incorporate some of that teaching with my fellows and with trainees I work with. I definitely wish I had had some more of that background in my medical school training, actually. I think one of the things I feel like and I think about this a lot now. I'm a doctor and preceptor here at Penn too, so I'm involved in medical education, and I'm definitely curious about how do we just teach healers to be able to meet suffering in ways that feel skillful and for them. And how do I do that for myself even more skillfully going forward? And I think that all of that work really melds with certainly my spiritual life and my meditation practice. So I think broadly, cultivating and getting even more present centered in all of those places is what I see myself doing. I'm pursuing an early career research award right now to do some of the research around some of these like cash-based transfer interventions in India. So I'm very excited about that. And I think getting curious about some of these policy level questions in mental health, I think would also be really exciting if that's available to me. And then, yeah, if maybe also bringing physicians together to think about some of these bigger picture. I think we might have to, like, whether I want to or not, I think we may just have to. So I think that might be a part of future life as well. And of course, like continuing to grow in my friendships in my family, all of those personal things in my relationships with my patients and friends. That's like, I love my work, but I feel just like none of it would be possible without friends like you, without my husband, my family, the people who nourish me, my mentors, some amazing people in my life.
Yeah, you should. That's leads very nicely into another strength of yours that I think bears commenting on, and I'd like to hear your insight into it. Is you are an incredibly open person. I know that we have friends from multiple different, political affiliations and involved in different conflict zones globally. And in the spirit, you're someone who navigates avoiding any sort of tribalism in a way that I think is unusual in 2024. You truly love and approach everyone with an open heart, and are probably one of the few people I've met who will never invoke politics as or paint people with a broad brush. So I'm curious how you don't succumb to that at a time when our country is just horrifically polarized and drifting further apart from each other. I think a lot of it is you don't use tech that much. Like I think that's
I was gonna say, I think not using social media, like that's remarkable.
Yeah, you're not getting into fights with people online.
Not hearing about it, not getting angry about it. Yeah. That helps. I actually think so much of the polarization around politics and tribalism is just bred online. So avoiding all of that online is a really useful tool. I think I also am really fortunate to have people who've guided me in that. Like my family, of course, like we exist between cultures, between the States and India. So existing between cultures means that, and in the case of India and the States, like such different cultures in some ways, means always having to remain in a state of openness to the best and the worst that each of those cultures can bring. I think like my family has been an early teacher for sure, and we could be different and still love each other.
Yeah,
We can be really different and
really
still.
different. Yeah.
And how do we do that again? I think actually my husband has also been a really amazing teacher in that, because I mean, him having grown up in Iran is a reminder and of what it's like to live in a state that where democracy has succumbed to a religious republic, and what the consequences of all that can be when we don't allow free speech, when we don't allow free discussion and open, respectful dialogue.
Yeah.
So I think that's something, because of his background and his parents' background, it's something I think I'm ever present to now. And yeah, I think just constantly interacting with people from so many different walks of life, especially my patients. I have patients who come from everywhere, every part of the world, every background, every political orientation. They never fail to surprise me. And yeah, it's like being awash in humanity and being reminded and humbled by it all the time, that I think helps me ground myself in that, and I think my spiritual practice too, like a regular
The limiting aspect of it. Yeah.
like regularly revisiting states where we're not as fully inhabited with our ego, and or and some of those like deity-based practices too, like these guides and wisdom who point us to the spaces in between that we sometimes miss. Yeah.
You know, I was reading recently, I don't know the exact numbers, but they just did a major study on how many friends the average American has in different, like I think they separated by 20-year age gaps, and it was it was very sad. I think we're not forming deep and meaningful friendships the way like my grandparents' generation did growing up in this country. And you know, it's funny, you and I met pretty late in life, like what, 2 years ago or something, and
Felt like a lifetime.
and we've enjoyed this rich and meaningful friendship that I think, you know, people just assume you have to cultivate since childhood to achieve this level of empathy and understanding and respect for another person. But the truth is you can stumble upon your next greatest friend at any moment in life. And so I thought we could close with you just talking about, you know, advice you have to the majority of Americans right now who are struggling with isolation. And it's not just young people, it's everyone apparently who don't know how to find a good friend and who need a good friend.
Oh, that's such a sweet question. And I just want to take a minute to say it is a gift always when you find someone like you late in life or any phase in life, and to find people who share values and a sense of love for people and curiosity, love of experience in the world. I I I remember meeting you for the first time and just immediately feeling you, and it's like falling in love. It's just such a gift, and um, yeah.
Yeah. I
I
think maybe seek out people who have values similar to your own, like find avenues where your soul sisters and soul brothers will naturally flock towards. I think maybe that's how I would advise people is follow your own interests and then other things will fall into place. I don't know. My mom always said that. That's
I love that. I think my advice might be something like the things that are in the way, whether that's tech or distractions from the things that really matter, to be able to clear those out of the way is, I think, a really helpful exercise. And then to get really clear on the things that do matter, and to get clear on, to be in touch with, I think to find soul sisters and soul brothers actually also requires to be in touch with one's own soul and our own sense of ourselves, and to vibrate with that, to live with that, and in presence with that. And then I think I found anyway for myself that when I was able to do that, then we are able to find that resonance with other people really beautifully and clearly. Like it just rings clear and true in a way that is so beautiful when it happens. And so I might advise the things that are distracting you or being in the way, clear those out of the way. That's in of itself like such an accomplishment. I don't want to make that simple. That's a big deal.
yeah.
Big deal. Get the things out of the way. And then when all that other stuff is out of the way, look at what's left. Be with it. Be with it in yourself, and trust that as you're with that in the world, you'll find each other. I feel like I was so lucky to have that happen for me. So.
Well, Esha, thank you so much. You are a wonderful person. You're a deep thinker, but you just have such an incredible amount of love for people, and your patients are very lucky to have you. and we certainly are lucky to have you as a friend. So thank you. We can and do routinely talk
Oh.
for hours at a time. So, but for the sake of time today, I think that's a nice place to end, reflecting on the strength and beauty of friendship and just the magnificence of the world around us. So with that, my dear, we will meet again soon.
Can't wait.
All right, dear. Tell your husband I said hello. And I am looking very forward to talking to him soon.
Will do.
All right, Esha, thank you so much.